Hi everyone, my name is Caitlin. So this is on the role of an NP. So first, what is a nurse practitioner? So a nurse practitioner, also abbreviated in Mass where I'm from as CNP, provides healthcare services to individuals throughout their entire lifespan. This includes health promotion, disease prevention, health education, counseling, making referrals to other members of the healthcare team, as well as diagnosing and managing acute as well as chronic illnesses and disease. An NP doesn't just provide care in the hospital setting. They're present in a variety of settings such as home care, hospitals, private offices, community and public health clinics, and nowadays even telehealth. A lot of NPs are telehealth. So how does a nurse practitioner differ from a physician's associate? So first is kind of how they're educated and the model by which they're educated. So nurse practitioners are trained under the nursing model, which emphasize holistic care, disease prevention, and continuity of care. Their education often includes either an MSN or a Master's of Science of Nursing, which is this current program, or a doctorate of nursing practice or a DNP program. The training is often centered on health promotion and patient-centered management. Physician's associates, on the other hand, are educated more under that medical model, which focuses heavier on pathophysiology, diagnosis, and treatment. They typically earn a master's degree in physician assistant studies and are trained as generalists with a broad medical knowledge. Next is in their licensures. So NPs are licensed by nursing boards and can practice independently in about over half of the US states with full practice authority. This allows them to evaluate patients, diagnose conditions, interpret diagnostic tests, and initiate treatments without a physician oversight, where PAs, on the other hand, are licensed through the medical boards and practice under physician supervision, um, although the level of oversight can vary by state. Next, NPs often choose a population-specific focus, such as I'm in the FNP course here, rather than like the women's health course or the pediatric course, or the psychiatric course. This shapes kind of some of the classes that we take and the certification exams. And as mentioned earlier, PAs more receive generalist training and often they specialize through on-the-job experience rather than like a formal certification exam. Next, how does a nurse practitioner differ from a physician? So, the first big one is obviously the training duration. Physicians complete about a minimum of 11 years of post-secondary education and training, which includes 4 years of med school and 3 to 7 years of residency, which is a lot of times over 12,000 hours of supervised clinical experience, where NPs, in contrast, generally complete 500 to 1,000 hours of supervised clinical practice, and it's typically a 2 to 3 postgraduate education. Physicians are also educated based on the biomedical model, similar to PAs, which emphasizes that pathophysiology and disease-centered care, where NPs, once again, are trained more based on the nursing model, which focuses on patient-centered care, and also incorporates more of the social, emotional, and physical aspects of health. And physicians obviously have unrestricted practice rights in all of the US states, and the scope of practice of NPs can vary between the states. Although a lot of states now, NPs do have full practice authority, but such as in Mass, oftentimes there's like a 2 year entry into practice, supervised period, or other situations such as that. Um, and then next, why don't you just become a physician? Question that a lot of people ask. So, obviously, besides the amount of schooling that it takes to become a physician rather than a nurse practitioner, many NPs and nurses, including myself, are more drawn to continue their education and expand their clinical authority without completely abandoning the nursing model and kind of some of the values that are instilled in us as nurses. And a lot of us have already been practicing as nurses in the hospitals or in other outpatient jobs, so our views might more closely align to the nursing model education rather than what the biomedical model of education is. Such as the nursing model prioritizes holistic relationship-based care, which I'm sure for a lot of us that have been doing inpatient nursing is some of our strong suits. Um, and those are key features that most nurses already value in their careers. Also, nurse practitioners are critical in closing the primary care gap in the US, which for me, that's the specialty that I'm going into and kind of the hopes of what my end job will be one day. The demand for NPs is expected to grow by 46% in 2031, compared to only about 3% for physicians. So there's definitely a need for NPs in that area. And some other research does show that patients are generally very happy with NPs as their primary care provider and in that situation.